This topic is chain of infection. The chain of infection is a process in which a pathogen, which is just a fancy term for a germ, whether it be a bacteria, a fungus, or a virus, is spread. Now, a pathogen must be present for an infection to occur, but the presence of the pathogen alone does not always mean an infection is present. So what do I mean by that? We have normal bacteria on our skin, but that doesn't mean that our skin is always infected. So if the pathogen itself, the presence of the pathogen, doesn't necessarily mean there's an infection, then how does infection occur? That's what we will find when we talk in detail about the chain of infection. So let's say you're talking with your friend who has the common cold. They're coughing and sneezing while you're having a conversation with them. So that common cold, or that virus, is the pathogen that's present. Your friend is the reservoir where that pathogen is living and replicating. That portal of exit is whenever your friend is coughing or sneezing. The mode of transmission is through those respiratory droplets when your friend sneezes. That pathogen then finds its portal of entry through your respiratory tract whenever you inhale those respiratory droplets. And you, my friend, are that new host of that virus. And the cycle continues. Now, it's important to know that the chain of infection can help us understand how infection occurs, but when we break that chain of infection, that's also important for us to understand how to prevent infections. So let's go back to our example of when we were talking with our friend who has the common cold. An example of breaking that chain of infection would be if your friend did a better job of covering their cough or covering their sneeze, or even wearing a mask to prevent those respiratory droplets from actually making their way to the portal of entry, which is your respiratory tract. Now let's discuss infectious agents in more detail. As previously stated, these pathogens or germs can be bacteria, fungi, viruses, or even protozoa. That's a type or main class of parasites. Now there are different types of pathogens or flora of pathogens. That just refers to a community of those pathogens. There's resident flora and transient flora. Now resident flora, think about you're a resident of whichever city you live in. That is your permanent home. It's the same concept with the resident flora. Whatever surface or body part that they are on or inside, that is where they live permanently. Now transient flora, they move from house to house to house. So this means, for instance, the bacteria on our skin is a transient flora where it can be passed by direct contact with another person and can move from their skin to another person's skin, and so on and so forth. Remember, a reservoir is required in order to continue this chain of infection. So what is a reservoir? A reservoir is just a type of environment in which that pathogen can replicate and survive. Examples of reservoirs include food and water. This means that that pathogen requires food or nutrition or requires water in order to survive. Some pathogens may require the presence of oxygen or thrive without the presence of oxygen, such as aerobic and anaerobic bacteria. Certain pH levels can affect which type of pathogen will survive or not, such as highly acidic areas or very basic environments. Temperature may also play a part. Some pathogens thrive in lower temperature or cool areas, and others thrive in more warm temperature or environment. Lack of light, for example, fungi love dark, damp areas, and that's where they thrive the most. Common reservoirs can include living things such as humans, animals, or insects. Other non-living reservoirs include food or water. Even fomites, which are inanimate objects such as clothing, furniture, or even utensils that can easily transmit diseases or pathogens. As you can see in the image to the right, here is an example of how pathogens can be passed from reservoir to reservoir. So in the first image, you can see that this is an insect reservoir passing pathogens to a human. For example, malaria. When a client is stung by a mosquito, that mosquito is passing that pathogen to that human reservoir. In the second image, this is an example of how their pathogens are passed from human to human. For example, the common cold that we discussed in the first slide. Now let's discuss portals of exit and entry. Now remember, we've discussed the infectious agents or the pathogens that must be present, which is the first link in the chain of infection. We've discussed the second link, which is the reservoirs. Now we're discussing portal of exit. Although these are combined, the portal of exit and the portal of entry can include the same types of example, but are not on the same link in the chain of infection. For instance, the respiratory tract and even mucous membranes can be a form of portal exit and portal entry. So as discussed with the example of the common cold, when your friend is sneezing, that is a portal of exit for the respiratory tract. And whenever you inhale those respiratory droplets, that's the portal of entry through the respiratory tract. Now, if you were to kiss your friend with the common cold, the portal of exit and entry would be the same. So if you kissed your friend, you're sharing saliva, so the portal of exit is the saliva through the mouth, and the portal of entry would also be saliva through the mouth. Blood may also be a portal of exit or entry. For example, if the nurse were to give a client an injection and then accidentally stick themselves with that same needle, that blood will be the portal of exit from the client and the portal of entry for the nurse. Transplacental transmission is also a portal of exit and entry, so the mother may pass pathogens to the fetus in utero. The gastrointestinal tract may also be a portal of exit and entry. For example, fecal to oral transmission. The genitourinary tract may also be a source of portal exit and entry. For example, when a urinary catheter is placed in a client. The urinary catheter is the portal of exit for the pathogen, and the client's urinary tract is the portal of entry. Although we've discussed portal of exit and entry together on this slide, remember, the current link in the chain of infection after reservoir is portal of exit. And next we're going to discuss modes of transmission. Pathogen transmission may occur via direct or indirect contact. Examples of indirect contact include airborne and droplet transmission. This occurs through coughing and sneezing. Examples of direct transmission include food or water that's contaminated, as well as blood, as discussed in the example when the nurse is giving an injection to the client and then accidentally sticks themselves. Medical devices are also a mode of transmission and an example of a direct contact for transmission. Contaminated objects such as toys, kitchen counters, or high-touch areas are also a mode of direct contact or transmission. Once the pathogen has a means of transmission, the next link in the chain of infection is portal of entry. We will not rediscuss this, but just remember that is the next link in the chain. Now let's discuss the next link in the chain of infection, the host. Now the host must be susceptible to infection. If not, then the chain is broken and infection is prevented. So let's discuss some of the factors that influence susceptibility to infection. The first factor is age. As we all know, our younger clients, such as infants and children, have a very immature immune system. This causes them to have a higher susceptibility for infection. This is also true for our older adult or geriatric population. Nutritional status is also key when it comes to susceptibility of infection. As we all know, protein helps wound healing. So for example, if a client has an open wound and has a decreased amount of protein in their diet, this will impair healing and therefore increase their risk for infection. The presence of chronic disease will impair the immune system and therefore cause immunosuppression. When a client is immunosuppressed, they're at increased risk for infection. Any type of bodily harm, such as bodily trauma or even smoking, can cause an increased susceptibility. As we all know, smoking can impair the immune defenses of the respiratory tract and therefore increase the risk of infection. Antibiotic resistance also plays a role in susceptibility of infection. If the client has a bacteria that is not susceptible to an antibiotic and forms a resistance, this is going to increase their risk for infection. And lastly, immune status is very important when it comes to our factors that influence susceptibility for infection. A few examples of immune status playing a factor can be for our clients who are immunosuppressed, like we've discussed previously. This increases their susceptibility. Clients who are taking specific medications, such as steroids for a long period of time, or clients who are receiving chemotherapy. This causes immunosuppression and therefore increases their risk for infection. We've made it through all the links of the chain of infection. Now let's discuss how we can break that chain and prevent infections. Our number one tool and priority always is to implement hand hygiene. If we can eliminate the presence of that pathogen, the chain will be broken immediately. Transmission-based precautions are also important in breaking the chain of infection, so the nurse always needs to implement the appropriate precautions. For example, neutropenic precautions for immunocompromised clients. Implementing sterile and aseptic techniques can be extremely important for the nurse to decrease the transmission of any type of pathogen. Cleaning equipment after use, or even cleaning high-touch areas such as toys, surfaces, or counters that are frequently used and shared is extremely important in breaking the chain of infection. As you can see in the image to the right, the nurse is breaking the chain of infection by covering that soiled dressing when removing their gloves. So what should the nurse include when providing client teaching? Infection prevention is key. The client needs to understand how to break that chain of infection. This can be done by proper hand washing and disinfecting high-touch areas as well as objects, such as kitchen counters and shared toys. The client may also prevent infection by staying up to date with immunizations. For example, hepatitis A is a frequently transmitted infection that can be prevented via a vaccine. Stress levels are frequently correlated with infection. When the client is extremely stressed, this causes the body to produce a hormone called cortisol. High cortisol levels are correlated with a decreased immune defense. So if we can teach the client how to reduce their stress levels, they will also be reducing their risk of infection. Taking care of their body with proper nutrition and adequate rest and exercise can also decrease the risk of infection by breaking that chain.